Hi, my name is Lucy Dunn, and I'm doing my EDS 522 disability presentation on twin-to-twin transfusion syndrome. I'd never heard of this until I had two twins come into my class that were survivors of this condition. Twin-to-twin transfusion syndrome occurs in identical twins and higher number multiple births. TTTS occurs when one twin, known as the donor, gives blood to the other twin, known as the recipient, through their shared placenta. There are some important warning signs of TTTS for pregnant mothers. They are a rapidly growing abdomen over 2 to 3 weeks, a uterus that measures larger than the due date, an abrupt increase in body weight, abdominal pain, tightness, or contractions, and swollen hands and feet early in the pregnancy. Some distinguishing characteristics of twin-to-twin transfusion syndrome are: the donor twin becomes small and anemic. Its bladder may not be visible on an ultrasound. It has little or no amniotic fluid around it. Sometimes this twin will appear to be stuck to the wall of the uterus. This is known as stuck twin phenomenon. The donor twin usually weighs 20% less than the recipient. The recipient twin, on the other hand, becomes large and has lots of blood. It urinates more and has more amniotic fluid around it. Its bladder may appear enlarged on an ultrasound. The recipient twin may show signs of congestive heart failure. According to the Texas Children's Hospital, less than 1% or 1 in 2,400 pregnancies of identical twins have a shared amniotic sac and placenta. TTTS occurs in 15 to 20% of identical twins who share a placenta. Twin-to-twin transfusion syndrome is usually diagnosed early in pregnancy with an ultrasound. However, it can occur at any point during a pregnancy, including while the mother is in labor. There are some warning signs of TTTS that are visible on an ultrasound, such as noticeable size differences in identical twins, also referred to as discordance, disparity in the size of the amniotic sacs, clear difference in the size of the umbilical cords, a shared placenta, signs of congestive heart failure in the recipient twin, excess amniotic fluid around the recipient twin, and little or no amniotic fluid around the donor twin. Twin-to-twin transfusion syndrome is neither hereditary nor genetic. It is a random event that is not preventable. According to the Fetal Hope Foundation, TTTS is caused by the unbalanced flow of blood through vascular channels that connect the circulatory systems of each twin via the common placenta. Mothers who are diagnosed with TTTS in mid-pregnancy are often malnourished. It is highly recommended that they drink protein shakes such as Boost or Ensure 3 times a day, in addition to the meals they already eat. Bed rest and weekly cervix checks are also recommended. If left untreated, twin-to-twin transfusion syndrome will lead to the death of one or both twins in 90% of twins with severe TTTS when it's discovered before 26 weeks of gestation. There are several different treatment options that families and their doctors can pursue to treat twin-to-twin transfusion syndrome. Several of them are referred to as treatments of hope, such as fetoscopic placental laser therapy, reduction amniocentesis, amniotic septicemia, and medication therapy. There are also 2 treatments that are referred to as treatments of hopelessness: the termination of the pregnancy of both twins through an abortion, or the termination of one twin who may possibly have birth defects in hopes that the normal twin will survive. There are some wonderful resources out on the internet about twin-to-twin transfusion syndrome. Wonderful website. They're very supportive of parents who are coping with this terrible condition. One of the original websites is called the Twin-to-Twin Transfusion Syndrome Foundation. It was founded by Mary Salmon Forsythe. She is the founder and director of the TTTS Foundation, and she is available to speak with families personally on the telephone about what they are going through. She is a mother who gave birth to twins who had TTTS. However, hers was a very sad story because her doctor did nothing to help her twins survive, and it resulted in the death of one of her twins. Also, Dr. Julian E. D'Elia, he was the man who developed the fetoscopic placental laser surgery. You can contact him through Mary and the Twin-to-Twin Transfusion Syndrome Foundation, or through his own website, I believe. And he will personally call parents and counsel them on what steps need to be taken next in the treatment of their unborn twins to help them have the best survival rate. Also, there's a wonderful website called the Twin Hope organization. There's also the Fetal Hope Foundation and the Texas Children's Hospital website. These are all wonderful websites that are all very caring and supportive of parents that answer any questions that you may have. So the best thing to do is just to Google Twin-to-Twin Transfusion Syndrome on the internet, and it'll bring up a list of these websites, and you can contact any or all of them to have your many questions answered. So thank you and good luck.